Clinic with Tapan Patel, having a spot of Botox, and you're going to do a bit on the forehead today?
Absolutely, a little full face treatment actually.
Full face treatment,
So
okay.
the way we're going to do it, we're going to use small amounts of Botox to give you a much more natural look, so you maintain some expression, but it just blunts the lines rather than removing them completely.
Okay, lovely.
It's just frown for me like you're angry and relax completely. And then raise your eyebrows as high as you can. Now turn this way for me. Give me a smile.
The crow's feet.
That's the ones.
Yeah.
Now look this way. Good.
I do scrunch up a lot around there.
There's an interesting muscle down here to treat. If you just frown for me. No, I'm sorry, turn the mouth corners down. There we go. That's it. And relax for me. So this is a very interesting muscle to treat because, in fact, a lot of people, without realizing it, turn the mouth corners down, and the net effect that has is it enhances your ability to blunt the jawline. So by treating that muscle, we keep the jawline nice and sharp.
Because I hadn't really realized I did that a lot until we were chatting one day and you pointed it out to me.
Yeah,
so well, I've been quite self-conscious about it since then. Of course, I do it far more, possibly as a result of realizing that it's one of the default things. You know, some people pop their eyes when they're surprised by something or purse their lips, and I find I do that.
Yeah, and we've spoken before about the fact that there's treatments and there's tweakments, and I think this is one of the very nice little tweakments that we can do to avoid excessive treatment in that area. So what I find it does is it just keeps the jawline nice and youthful, it keeps it nice and fresh, and there's a lot of people who that's all they will need, just a little injection of Botox just to the sides of the chin.
Terrific.
And we can again, review you after that. So.
Yeah. And do people dispose, or does their body use up the Botox faster depending on their metabolism? Because I know that's how it works with fillers. Is it the same with Botox? Or
it's difficult to just put it down to one factor. Okay. It's multifactorial. There's no doubt that there is a range.
Yeah.
Some people will find the Botox only lasts a couple of months, whereas for others it's 6. But 3 to 4 months is average.
Yeah. Also depends on how much you go and put in the first place, doesn't it?
Exactly. It is dose responsive, and therefore, if somebody wants a very frozen look, which I don't like, it's probably going to last a bit longer. We prefer a more natural look where you maintain some expression, and the downside of that is it does last a little bit less long.
Yes.
All right.
You can't completely have your cake and eat it.
You got it. So just relax for me. Okay, here we go. A little scratch. Well done.
It's so easy. I mean, there's no anaesthetic, but really, I can hardly feel it.
Well, that's right, and I think people sometimes who've not had the treatment get a little concerned when they hear that it's an injection, but it's worth remembering that the needles are tiny, and what we're doing is we're putting it in very specific places, tiny little doses, and the idea is that therefore what we should find is that you get a nice overall balanced result, and my philosophy has always been that we can add more in. We can't take it out.
Okay.
So what I always do is put a small amount in, then I can review you, and we can decide if that's about right or not. Yeah, it's the upper bit done.
Thank you.
Now I'm just going to do the sides of that. And the other side.
Tiny pinprick. I can feel that down there.
For some reason, it's a little bit more obvious lower down in the face.
And in the chin, you do that to stop the bunching up?
Correct.
Of the chin?
So the chin is a very active muscle, and when we activate that, exactly when you do that, you can sometimes see almost what we call cobblestoning. And over a period of time, that actually changes the skin texture.
Yeah.
So when I notice that somebody, as part of their normal expression, is making a lot of use of their chin muscles, I like to soften that, and over time what that does, it keeps the skin nice and soft in balance with the rest of the face.
Okay.
Now we'll treat these little things around the eye. Little scratch.
It's such a tiny scratch. I find when I'm writing about treatments and the girls who commission me say, so what's the pain factor? 1 to 10. And for something like this, I'd say, oh, it's a 3 or a 2. It's nothing. And they laugh and say, yeah, but your 3 or 2 is probably like our 5 or 6. And it's very hard to convince them otherwise.
That's right. But I think.
So tiny pinpricks, which you can see them now, but I know in a few hours.
Probably not even a few
really
hours, probably 20 minutes probably. There'll be no real evidence that you've had anything done.
Yeah, I'm off around town now, and people are quite used to me turning up for meetings, looking like I've run into a sharp needle or two. Anyway, thank you very much.
Absolute pleasure.